Hi, I'm Krista Lara. I am a senior undergraduate in exercise science in the Department of Health and Human Performance. Today, I will be presenting hemodynamics and pulse wave reflection after different orders of resistance exercises. Research has shown how upper and lower body resistance exercises produces different responses on the cardiovascular system. That study had two groups perform either upper or lower body resistance exercises separately. The data from that study found there was an interesting difference between both groups. However, the combination of using both exercises has yet to be looked into and to find how the body responds to different orders. The purpose of this ongoing study focuses on the orders of both upper and lower body resistance exercises to determine if it may affect the responses on the cardiovascular system. Before starting any testing or exercise, participants met for a session to talk about informed consent, health questionnaires, and ask any questions regarding the study. After this, participants had their measurements of age, height, weight, and body mass index taken. The characteristics of all these participants averaged at the age of 22, their height at 1.74 meters, their weight at 65.8 kilograms, and a body mass index at 24.59. The participants were 5 college men who volunteered to be a part of the study. They had engaged in regular physical activity as per the requirement was for the past 3 months for at least 3 days of the week. During these 2 sessions, they were tested for their 1 repetition maximum on 2 separate days. They performed 2 upper body exercises and 2 lower body exercises. The second visit was a verification of their 1 repetition maximum. Participants met for 2 sessions more that would test their hemodynamics and pulse wave reflection before and after resistance exercise. They arrived at the lab and rested in a supine position for 10 minutes at rest. Between 10 and 15 minutes, measurements were taken. After a total of 20 minutes passed, participants would be taken to the testing room to warm up and perform exercise. They would walk on a treadmill for about 5 minutes. Participants started with upper body or lower body order depending on their first session. And their second session would be the opposite of how they started to change the order. There were a total of 4 exercises with 2 per each group, as mentioned in the 1 repetition maximum testing. The upper body exercises were the lat pull down and the incline chest press. The lower body exercises were the knee extension and knee flexion. They had 1 set at 50% of their 1 repetition maximum for 10 reps as a warm-up set per each exercise. They performed at 75% of their 1 repetition maximum for 3 sets for 10 repetitions for all 4 exercises. They had 1 minute of rest in between each set, while they had 2 minutes of rest in between each exercise. As soon as they finished, they would go back to the lab to have their measurements taken again. Participants rested in a supine position during recovery. Measurements were taken between 10 and 15 minutes for recovery 1, and between 20 and 25 minutes once more during recovery 2. It would take a total of 30 minutes to complete recovery overall. Results are shown in the table, and there is a legend below to explain what these symbols next to numbers mean. The data for heart rate, brachial systolic blood pressure show there was a response despite the orders of exercise in both recovery 1 and 2 compared to rest. The same can be said for aortic systolic blood pressure, where there was difference and change in recovery 1 and 2 for both orders compared to rest. The last 3 are augmentation pressure, augmentation index, and augmentation index normalized at 75 beats per minute show there was a higher change for the groups that followed lower upper compared to upper lower. And the diastolic blood pressure for brachial and aortic had no changes from rest to recovery to. As can be seen, there are no symbols between any of those because there were no changes at all. The data suggests that the order combinations of upper lower and lower upper had similar changes in heart rate, brachial, and aortic systolic blood pressure in all participants. The data from pulse wave reflections shows that lower upper had a higher effect on the cardiovascular system compared to the upper lower order. Now, you might ask, what does this mean? What it means is both conditions have the same total volume as the exercise were performed, but had varying cardiovascular responses. So the use of upper body exercises places a greater amount of stress because of how close those muscles are to the heart. This is why when performing lower upper, lower takes time to reach back up to the heart, while performing upper was already placing that stress. So the combination increased those during the last three variables compared to upper lower, where the body had more time to use that stress and decrease it as the exercises were performed. So if you want to perform full body, use two groups, you might consider using upper lower just because of its responses on the body. And for future studies, they should examine the different combinations of upper lower body resistance exercises on hemodynamics and pulse wave reflection. Thank you.